Precipitated withdrawal. Getting kicked into withdrawal immediately within a second. That's what we're going to get into today. Let's go. K-Rugs, the Sober Dog, coming at you. Hey, before we get into all the precipitated withdrawal, if you want to help support Sober Dogs, check out our Patreon page. Really appreciate anything anyone can help out with. Also, you know the deal. Hit that like, that subscribe. If you're a Sober Dog, leave a comment. Yeah. What is precipitated withdrawal? Precipitated withdrawal can occur when an antagonist or partial antagonist like Suboxone, buprenorphine, which is the main ingredient in Suboxone, is administered to a patient dependent on a full opioid antagonist. To break that down is somebody who's dependent on heroin, Oxycontin, Percocet, morphine, fentanyl, any of those full opioid antagonists that are going to the mu receptors in the brain and binding to our receptors. When somebody takes a partial antagonist, it goes in there and kicks those out and replaces it. So now what happens is the full antagonist was up there binding to our receptors, giving us the high, the effect of the opioid. The partial comes in, not only does it kick those other ones out, it replaces it. Now, when it replaces it, it's not nearly as powerful or as strong as the full antagonists. So that, the combination of kicking out the full antagonist and replacing it with something way less, sends us into immediate withdrawal. Totally brutal. That whole withdrawal that I've explained in other videos where 8, 12, 14, 24 hours to kind of fully kick in, all that happens in a second. Nausea, vomiting, diarrhea, chills, bone aches, all that. Immediate. And it sucks. It is brutal. A major case where you guys might have, I'm sure you've heard about it, is when people get Narcan. So when somebody's overdosing and they get Narcan, the Narcan kicks out all the opioids in those receptors. But now, different than the Suboxone replaces it. The Narcan doesn't. It just kicks it all out. So the person goes from, they're experiencing this very, euphoric high to overdosing, unconscious, to boom, the second they wake up, they're in full withdrawal. That's why people might say like, oh, the person got Narcan and they woke up and they were an asshole, they were miserable, they were a prick, they weren't grateful. The EMTs, I've heard say that before. What you got to understand is it's not that person's not grateful. I can't speak for everybody, of course, but it's that even if their mindset is, thank you for bringing me back to life, their entire body is screaming at them in a total chaos situation of full-blown, all over the place withdrawal. Like their body, every check engine light, every light in the dash is on, sweating, vomiting, diarrhea, chills, nausea, just their body is going a million miles an hour the second they wake up in a total panic. So that's why they might be a prick or miserable. This also happens when people go to a Suboxone doctor or any doctor, their doctor to get put on, an MAT, medication-assisted treatment or medication-assisted therapy. They go to the doctor and, doc, I'm an opioid addict, and can you please help me and put me on Suboxone or something to start a recovery? What the doctor has to do is they got to wait 24 hours from the last time that person took an opioid until they can administer Suboxone. Now, as you recall in the other videos, withdrawal starts, depending on the opioid, anywhere from 4 to 8 hours, after the last use. So from hour 8 to hour 24, that person's got to be in withdrawal for the doctor to administer the Suboxone. That is one of the tough parts of Suboxone is it is literally, said right in the paperwork that do not administer until the patient is in mild withdrawal, at minimum mild withdrawal symptoms. How the doctors measure that, the couple times I've had to do that with the doctor is the doctor literally, sits there and is analyzing me and asking me my symptoms, how I'm feeling and all that, seeing if I'm in withdrawal. And then also had me go sit on the couch and wait 2 hours and then administered the Suboxone and had me wait again to see how I felt after, if it was going to push me into precipitated withdrawal. How they kind of eliminate that is they do very small amounts to start. First of all, they wait the full 24 hours. Then they do very small amounts to start off, and they'll increase. But how they determine if somebody's in withdrawal is what's called, the COWS. It's the Clinical Opiate Withdrawal Scale. And what those are is the 11 most common symptoms of opioid withdrawal. And these symptoms are what we've talked about in other videos and everything. Pulse rate, they got to check if it's very high or very low. Excessive sweating, restlessness, patient's pupil size, bone and joint aches, runny nose, gastrointestinal issues, observable tremors, yawning, excessive yawning, anxiety and irritability, and goosebumps. If the patient classifies as having minimum 5 or 6 of those, that's considered they're in mild withdrawal. This is also the reason why a lot of people think Suboxone doesn't work, is they take an opioid and then they, want to quit, or they want to get clean or whatever. So they take Suboxone. Maybe they do it on their own. Maybe they do it with a doctor, but they take it too early and are sent into precipitated withdrawal. So all of a sudden now they're just feel like total crap. And in their mind, wow, see, Suboxone doesn't work. It sent me into withdrawal. But that's not the case. It is what happened, but if they wait a little bit longer, or the doctor will then probably start administering a little bit more to kick out the precipitated withdrawal, they'll realize that that just happened because they didn't wait long enough, and that it does, in the vast majority of cases, help. So that is precipitated withdrawal. It sucks. I've had it happen multiple times, and that's what I'm going to tell you about in the next video. All right? K Ruggs, the Sober Dog, and I'm out. See ya.